really exciting. And we'll come to questions. We've got some questions in the chat, and we'll come to those. We're going to come to the last speaker now, who's Dr Helen Stewart, who's based up at Sheffield Children's Hospital. She's also part of the executive or within the Royal College of Paediatrics and Child Health, and she's been supporting some of the core content work. And this relates to the rolling out of Healthier Together to all ICSs across England, is that we do need a repository of core content that saves reinventing of the wheel and makes that process more efficient and ensures high quality, consistent care. So the RCPCH, we've worked very closely with them for a number of years, probably starting most so with COVID, and then RSV bronchiolitis, and then Group A strep. A great organisation to work with. So Helen, it'd be really interesting to hear how we can continue to collaborate and Healthier Together can support the vision of the RCPCH.
Hi, thanks for having me. I'll try and share my slides. Okay, can you see that?
Yes, we can. Thanks, Helen.
Super, thanks. Right. Hi, thanks for having me. So my name's Helen Stewart. I am a consultant in paediatric emergency medicine up in Sheffield at the Children's Hospital. And I'm also the Officer for Health Improvement at the RCPCH. I came to Healthier Together by two routes, really. In the emergency department, I'm the department lead for mental health and for health improvement, health promotion. And so I was asked to come on board with the with the Yorkshire and Humber version of Healthier Together to provide the emergency department perspective on our clinical advice. And then I now, as Sanjay said, sit on the core group from an RCPCH perspective, and also representing Yorkshire and Humber at times as well. And so they've asked me to come along today and speak about how can Healthier Together support the RCPCH vision. So some of you may be aware, but the Royal College of Paediatrics and Child Health started out in 1928 as the British Paediatric Association. It was formed to advance the study of paediatrics, to promote friendship amongst paediatricians, bit of joint working, and to, in quotes, to advance for the benefit of the public education in child health and paediatrics, and to relieve sickness by promoting improvements in paediatric practice. So from the start, it's been quite different to other colleges and similar organisations, because child health has always been an active priority rather than focusing on the illness element of the specialty. So for instance, during the outbreak of World War II, the British Paediatric Association was involved in lobbying government for measures to safeguard the health of evacuated children. And over the years, they continued to campaign for improvements in child health. So in 1996, we were confirmed as a college by the Privy Council, and that was designated royal in October that year. And Princess Anne was named as our royal patron, and she remains so to this day. And we've kept that child health element in the title of the college, which does make us unique amongst the royal colleges. So the RCPCH vision is to lead the way in child health. And the Healthier Together website, I've always found, as it spreads around the UK, it does lead the way in child health. It's an innovative approach, improves the quality of care of children in those regions, and improves their care experience. No parent wants to be in A&E if they can possibly help it. So it improves their care experience if it means that they can feel more confident to manage safely children's ill health at home. And that feeds into our mission. So the mission for the college is make the health and well-being of infants, children, young people the core of all we do, ensure paediatricians have the knowledge and expertise to promote and support child health, make a measurable contribution to the improvement of health, both in the UK and across the world, and shape policy and practice so that we have high quality, safe, sustainable health services. And Healthy Together is a hugely valuable resource in this area. For parents and carers, it has the health and well-being of children and parents at its core. It's there for every health professional that sees children, not just paediatricians. any child healthcare professional, provides the knowledge to ensure a consistent approach to child illness and health across the workforce, from primary through to secondary and tertiary care. I know it's been mentioned already, but parents are often confused by mixed messages. I find a lot of parents that I see in A&E, they've come because they've been told different things by different healthcare professionals and they're just not sure, and they lose confidence. So receiving that same consistent message from different sources really increases confidence in the health system and in their own ability to manage the child at home, that they can rely on the advice that they've been given. And it does seem to be making a measurable difference. I know when we were first starting Yorkshire and Humber and looking at the data from Wessex, we saw that it led to a much slower increase in paediatric emergency department attendances than was seen elsewhere in the country, and a pause in the rise of demand for GP appointments. As I said, I work in a peds emergency department. Our numbers have gone up and up. They were going up by 2,000 or 3,000 a year. Last year, they spiked more due to the Group A strep situation, and a lot of that was primary care problems with parents that were just really worried and wanted some reassurance. So if there's somewhere else that we can point them, that is incredibly useful. And anything that could help with those current trends of ever increasing presentations. And the reduction in demand contributes to the sustainability of our healthcare services. It helps staff feel less under pressure, and opens up those appointments for other people to use. So innovative solution, and it really has been having an impact. The RCPCH values. So like all organisations, we have our values as well as our mission: to innovate, approach things creatively, to influence for better child health, to include, embrace diversity, and to lead ourselves, others, become positive role models. So, and Healthier Together is consistent with those values. It's clearly innovative. There was nothing like it before. It influences, sharing that best practice, promoting better child health, and it considers the diverse population that we serve. It can be translated, it's got the read aloud option, and it values the input of a wide variety of health professionals. In Yorkshire and Humber, our clinical content group, we've got a spread across primary, secondary care, including doctors, nurses, allied health professionals. And I use that network now for other situations, other issues that arise, looking for ways that we can work better together across the different areas of healthcare. And so going forward, Healthier Together fits with the mission and values, but I think it has the capacity to really support RCPCH strategy. This is the current strategy. It was developed in 2021. It will be refreshed in a couple of years. And there are a few strands, but the key headlines: harnessing knowledge, data and intelligence, equip members with the skills and knowledge they need, speak with confidence and authority on health issues, and develop those communities, supporting members throughout their career, and ensuring financial stability. So Healthier Together uses that knowledge to drive up standards of care, aims to provide medical advice to many who don't always have equal access to healthcare, and it's equipping members and child health professionals with knowledge, and it's bringing together those communities of practice. So I think it's been an incredibly useful innovation, and really does work towards all the aims of the Royal College of Paediatrics. So going for the future, obviously RCPCH has different focuses at different times external to the strategy, often in response to live issues. And currently, health improvement, promotion, and reducing health inequalities is a key part of the college's work. We're currently in the middle of a 3-year programme. Last year we focused on child poverty. This year it's about climate change and inequality. And there'll be another topic next year, which we're working on at the moment. And many of you probably know, but it's estimated that healthcare services are responsible for only about 15 to 20% of health outcomes. And the rest is due to the social determinants of health that result in those health inequalities. So poverty, education, housing. And as the Officer for Health Improvement, I've got a particular interest in the health promotion and prevention capabilities of Healthier Together. Recently, RCPCH and the Faculty of Public Health produced a paper called Securing a Healthy Future, Prevention is Better Than Cure. This was a response to quite disappointing recent pullback on a lot of legislation that could have really benefited child health. So the Inequalities White Paper, that got shelved. There was a 10-year mental health plan, and measures to prevent childhood obesity have also been drawn back. So we came up with 5 key indicators of child health. We've got the 4 there: vaccinations, healthy weight, oral health, and mental health. And the other one that went along with that was clean air as an indicator. And there were a number of asks from government. The paper's available online if you wanted to read it. But one of the things was a cabinet level Minister for Children to ensure a health in all policies approach. So Healthy Together, I think, really has a huge potential in this area. Most of them have mental health sections. I looked at a couple, they've got oral health sections. But there is more scope to potentially pages on vaccinations, trying to dispel some of those common myths in non-judgmental fashion, advising parents how they can catch up with vaccinations, particularly as we see measles going on the increase in London and across the country, actually. Healthy weight pages. I think as the forum grows and parents start getting used to seeking it out for medical advice and they go to trust it, it makes sense that they will then be able to go there for other advice about their children's health, about how they can improve it. And I think that consistency that's been mentioned a few times really helps to build that trust. In Yorkshire and Humber, we also do things like signpost to food banks and citizens' advice, and we're thinking about using it as a repository for our heads' information as we bring that into the emergency department. So it's got it can really build on that trust to really get out a lot of the key messages that we're trying to get out there to improve child health. So thanks very much. I think it just Healthy Together really reflects the values of RCPCH and that increase in trust for child health advice. So I think it's really exciting about where this can go in the next couple of years.